Yeah, nitric acid. Nitric acid. Have a look in Allen's nitric acid. The line cracking in the jaw, cracking in the ears on masticating. Got that? No, not there. And there's another medicine which is there especially for him, for the ears. In Urtica, if he has a look, Angostura vera. That is also very specific for cracking in the joints. Any joint, but TMJ as well, but lots of cracking you find with Angostura. But Angostura is a syphilitic medicine. I'm just writing it here, cracking in joints. If it's in general, then benzoic acid and Angostura. Angostura is prepared from coffee. You open Angostura, and if it's cracking, especially in the jaws, then you have that in graphitis and nitric acid. But Angostura works really well for the cracking in the joints. But Angostura will drink 50 cups of coffee every day. You see, in the introduction of Angostura and Urtica, it's mentioned the greatest craving for coffee is characteristic. It's a very syphilitic medicine, Angostura. So you have a lot of degenerative changes, but if you see the introduction, it's mentioned crackling in all joints. And next time you see it's mentioned greatest craving for coffee. In general, cracking, benzoic acid, Angostura. But Angostura is more syphilitic, so you get a lot of syphilitic diseases. Like in India, we come across osteomyelitis. It's a degenerative condition of the bones.
オステオは骨だよね。骨髄炎っていうの？
So you know, degenerative, lot of advanced bone diseases with cracking, Angostura can help. crackling in the joints, these two can definitely take care of it. You understand that's a discomfort. Constantly, if they're moving, if they're walking, they feel it sometimes, others can sometimes hear it. It becomes an embarrassment. That's about your benzoic acid. Berberis. Typically migratory pain in Berberis. What will aggravate Berberis? Any kind of jarring. What is jarring? Sudden movement. So you're in a car and you suddenly braked. So like a jarring movement. So sudden stop, a sudden movement always aggravates Berberis. And remember, like sulfur in Berberis, they cannot stand for long, standing aggravation. So left-sided medicine is Berberis, with a lot of migratory pains, wandering pains, worse from standing, worse from jarring. You see here, this is specific of gout. You see the great toe is affected. Initially becomes red and gradually the pain starts. You can use Berberis in tincture, 6C as well. That's about your Berberis vulgaris. I repeat again, left-sided medicine with migratory pains, with two interesting modalities, worse from movement, worse from jarring and worse from standing. My next one. Medicine number 8. What other things you can prescribe this medicine for? Anyone? Hives, very good. From? Nettles, okay. Hives, yes, good. Whenever you have gout in an allergy constitution, and to control that acute pain, gout in an allergy constitution, to control that acute pain, Urtica Urens can help. So a lot of pain in an allergy constitution. There are lots and lots of good areas of prescribing Urtica Urens. It's a superb acute remedy. As you shared, it's a medicine for hives. Remember, what acts wonderfully well if you have shellfish allergy. Right? So lobsters, prawns, crab, and you have an allergic reaction from that. Urtica Urens is your topmost medicine. There was a question, can you discuss about food allergy? We have an entire session on dermatology. We'll be talking about specific food items and how you have specific remedies to counteract that. So we'll be talking about that in detail. So we'll take up urticaria in the dermatology session. Okay. So hives is a wonderful area of action, especially from shellfish. I want you to try Urtica urens for burns. Burns with a lot of vesicles. When you have tried cantharis isn't working or not acting speedily, try Urtica urens. You know, absolutely superficial burns, cantharis will help. Absolutely superficial burns, cantharis will help. But if there is a little more tissue involvement, cantharis isn't helping, you try Urtica urens. Urtica urens is a really useful medicine for burns. You can give it internally, you can apply it locally as well. Anyone tried it for burns? No. Try it, whenever you are not having good results with cantharis, try Urtica urens. Works really well. You get Urtica urens cream as well, you can apply locally for burns. Very good action. You have a look in Boricate mentions about burns. In the skin section mentions burns and scalds. Skin section. Give it internally, apply locally as well. And what will you give for deep burns? Like if it's really deep, tissues has been damaged, patient has to be hospitalized. Good causticum can help in those cases as well, but causticum is more like it had healed earlier, but then again, the infection came back. But if you think of cases where it hasn't healed at all completely, the medicine which we have used with good results is carbolic acid. Where it's turning into an ulcer, it's turning into an abscess state. So what we call this as like a third degree burn, like a very deep burn. Carbolic acid can help. With causticum, she's absolutely correct. Causticum can help you with long-term effects of burns as well. But if you are there in a blast or if you are there in an explosion, and if it's a very deep burn, patient is on heavy dosage of antibiotics, but it's still not healing, you should try carbolic acid in those cases. Have a quick look in Allen's, please, for carbolic acid. These are very practical things you come across in day-to-day life. If you look in carbolic acid, Allen's, please. line analysis, burns tend to ulceration. Burns tend to ulceration. So when burns are tending to ulceration, please put these three in the clinical tips for burns. If it's a superficial burn with redness, cancerous. If it's slighter deep burn with vesicles, Urtica urens. And if it's very deep, extensive burn with ulceration, carbolic acid. And long-term effects of burn, caustic. And caustic will be emotionally and physically affected by the burn accident. But not these two. Carbolic acid always in potency 200C and 30C. Coming back to Urtica urens, I hope everyone got carbolic acid. I shared with you hives, shellfish allergies. I shared with you medicine for burns. Urtica urens is also medicine for gout, as I shared with you, with allergic symptoms. And lastly, I want you to try Urtica urens in a patient who is breastfeeding but the milk quantity is less. It works really well for agalactia. Agalactia is lack of milk secretion. If you've seen Urtica urens in body care, first line, remedy for agalactia. Small medicine, but so good areas, so practical areas to use. You find gout patients, You'll find hives patients, you'll find burn patients, and breast milk quantity is poor, you'll find that as well. Urtica can help with all of these reasons. So that's more or less about your gout medicines. I shared with you amon false. If you recall these kind of nodosities if you have. It's a look and diagnose prescription. I shared with you benzoic acid. It's a hear and diagnose prescription. Cut. And it's benzoic acid. I shared with you Berberis. Left-sided. With standing mode aggravation.